Food addiction is a mental disorder, behavioral issue. Look at this picture shows that food addiction behaviors, a detail going on. Introduction. Food addiction is a behavioral disorder characterized by compulsive consumption of highly palatable foods despite negative consequences. It shares similarities with substance addiction involving craving, loss of control, and continued consumption despite adverse effects. This condition can contribute to obesity, metabolic disorders, and mental health issues. Definition. Food addiction is a chronic condition in which individuals develop an uncontrollable urge to consume food rich in sugar, fat, and salt. It involves changes in the brain reward system, similar to drug and alcohol addiction, leading to excessive eating behaviors. The American Psychiatric Association does not officially recognize food addiction as a distinct disorder in the DSM 5, but research supports its existence as a form of behavioral addiction. Etymology. The term food addiction combines food from the older English "fooda" meaning nourishment or sustenance, and addiction derived from the Latin addictio meaning a formal giving over or surrender, later evolving to signify compulsive dependence. The phrase emerged in modern psychology to describe an uncontrollable craving for certain foods similar to substance addiction. Types Types 1. Sugar addiction, excessive craving and consumption of sugary foods and beverages. 2. Carbohydrate addiction, dependence on refined carbs like wheat bread, pasta, and pastries. 3. Fat addiction, overconsumption of fatty foods like fried items, cheese, and processed snacks. 4. Fat food addiction, dependence on processed and fast foods due to high sugar, fat, and salt content. 5. Caffeine addiction. Excessive intake of caffeinated products like coffee, energy drinks, and chocolate. Causes. Several factors contribute to the development of food addiction, including A. Biological causes. 1. Dysregulation of dopamine, the pleasure neurotransmitter. 2. Genetic predisposition. 3. Hormonal imbalances. Example, lipid resistance, ghrelin overproduction. B. Psychological causes. 1. Emotional eating as a coping mechanism. 2. Anxiety, depression, or stress related eating. 3. Childhood trauma or neglect. C. Social and environmental factors, including 1. Easy availability of processed high calorie foods. 2. Cultural habits and social eating norms. 3. Influence of food marketing and advertisements. Risk factors. Several factors increases the likelihood of developing food addiction. 1. Genetics. Family history of addiction, food, alcohol, drugs. 2. Psychological disorders, depression, anxiety, being eating disorders, BED. 3. A dieting history, frequent restrictive diet leads to binge eating. 4. Chronic stress, emotional triggers leading to overeating. 5. Sedentary lifestyle, lack of physical activity associated with compulsive eating. Complications. Untreated food addiction can lead to various health issues, including physical complications. 1. Obesity. 2. Type 2 diabetes. 3. Hypertension. 4. Heart diseases. 5. Gastrointestinal disorders. Then psychological complications. 1. Depression and anxiety disorders. 2. Low self-esteem. 3. Social withdrawal and isolation. Social and behavioral complications. 1. Poor interpersonal relationship. 2. Financial strain from excessive food spending. 3. Reduced productivity and workplace issues. Pathophysiology. Step by step pathophysiology of food addiction. 1. Triggering stimulus. Hyperpalatable foods. Processed foods high in sugar, fat, and salt activate the brain's reward system. 2. Dopamine release. Reward pathway activation. These food stimulate dopamine release in the nucleus accumbens, reinforcing pleasure and craving. 3. Repeated exposure neuroadaptation. Chronic consumption leads to down regulation of dopamine receptors, requiring more food to achieve the same pleasure or tolerance. 4. Loss of control. The prefrontal cortex responsible for impulsive control, weakness, making it harder to resist craving. 5. Compulsive eating, habit formation. Eating becomes a compulsive behavior derived by habit rather than hunger, similar to drug addiction. 6. Withdrawal symptoms, negative reinforcement. When deprived individuals experience irritability, anxiety, and craving, reinforcing the cycle. 7. Metabolic and hormonal disruptions, insulin resistance, leptin resistance, and increased cortisol levels. Stress response contribute to overeating. 8. Long-term consequences leads to obesity, diabetes, cardiovascular diseases, and psychological disorders like depression and anxiety. Signs and symptoms. 1. Behavioral symptoms. Uncontrollable craving for specific foods. Eating despite feeling full. Repeated failed attempts to cut down food intake. 2. Physical symptoms. Weight fluctuations, fatigue and lethargy, digestive issues. 3. Emotional and psychological symptoms. Guilt or shame after eating, depression and mood swing, anxiety related to food availability. A diagnosis, medical diagnosis of food addiction. There is no standard diagnostic test, but clinicians use 1. Yale Food Addiction Scale, a widely used tool assessing addictive eating behaviors. 2. Clinical history, evaluating binge eating episodes, emotional triggers, and loss of control. 3. Physical examination, checking for obesity, metabolic disorders, and associated health conditions. Nursing diagnosis. 1. Imbalanced nutrition, more than body requirements related to excessive calorie intake. 2. Ineffective coping related to emotional dependency on food. 3. Disturbed body image related to weight gain and self perception. 4. Risk for low self esteem due to weight related stigma. Medical management. 1. Cognitive behavioral therapy to address emotional triggers and unhealthy eating patterns. 2. Medications. In severe cases, bupropion, naltrexone for craving. Licit examphetamine for binge eating disorder. SSRIs for anxiety and depression. Nursing management. 1. Educate patients on healthy eating habits. 2. Encourage mindfulness based eating approaches. 3. Monitor physical health, weight, blood sugar, BP. 4. Provide emotional support and refer to counseling if needed. Treatment options. 1. Behavioral therapy, cognitive restructuring of thought patterns, mindful eating techniques. 2. Nutritional therapy, balance meal plans with protein control, gradual reduction of sugar and processed foods. 3. Medications, appetite suppressants if clinically indicated. 4. Support groups, Overeaters Anonymous OA, group therapy sessions. Psychosocial medicine. 1. Cognitive behavioral therapy CBT, help individuals identify and modify negative thought patterns and behaviors related to food craving and compulsive eating. 2. Mindfulness based eating therapy MB EAT, encourages mindful eating practices to improve awareness of hunger, satiety, and emotional triggers. 3. 12-step programs. Example, Overeaters Anonymous provides peer support and structured recovery principles similar to Alcohol Anonymous. 4. Motivational interviewing MI, a client centered approach that enhances motivation for change by resolving ambivalence toward healthier eating habits. 5. Family based therapy FBT or group therapy engages family members or peer groups to create a supportive environment and address social influence on food addiction. Prevention 1. Educating individuals about dangers of food addiction. 2. Encouraging healthy eating habits from an early age. 3. Regulating food advertisements targeting children. 4. Implementing school and workplace wellness programs. 5. Addressing mental health issues proactively. In conclusion, food addiction is a serious condition with significant physical and psychological consequences. Although not officially classified as a disorder, it affects millions of worldwide. Early diagnosis, lifestyle modifications, therapy, and social support play a crucial role in managing and preventing food addiction. By promoting awareness, balanced nutrition, and mental well being, individuals can develop healthier relationship with food and improve overall quality of life. Thank you. Have a nice day.